Good afternoon. Thank you for attending. The Tippecanoe County Health Department is announcing that we now have one confirmed case of coronavirus in Indiana. It is in Marion County. Because of this confirmation, the Tippecanoe County Health Department is declaring a public health emergency at this time. The individual in Marion County is under investigation to determine the source of transmission. Due to this confirmed case, we are providing recommendations to the community to protect persons at higher risk of serious illness due to the virus. We ask for the public's help in sharing these recommendations, staying calm, and following prior recommendations issued by the Indiana State Department of Health and the CDC. The Tippecanoe County Health Department is working closely with the Indiana State Department of Health and our community partners to continue to stay in front of this. We have been anticipating this coming to Indiana and have been preparing for it. There have been no other confirmed cases in Indiana, and there are no confirmed cases in Tippecanoe County. The Indiana State Department of Health remains the only agency able to test for coronavirus in Indiana. They have limited tests available, and there are strict criteria for testing. Tests will only be done on individuals with symptoms consistent with coronavirus who also have an elevated risk for exposure to coronavirus. Our declaration of a public health emergency involves the following. We will be providing recommendations to the high-risk population in our county. The best evidence currently available makes it clear that the risk of severe illness begins to increase at age 50 for those who contract the virus and increases with age. The highest risk group patients are people ages 80 and over. Also at high risk are persons with underlying medical problems that compromise their immune system. We recommend that persons who are at higher risk avoid gatherings where large numbers of people are within arm's length of one another. This would not include typical office environments, grocery stores, or shopping centers, where it is unusual for large numbers of people to be within arm's length of one another. We're also recommending that organizations that primarily serve seniors or medically vulnerable individuals please follow recommendations, including canceling mass gatherings, and that they ensure that they are attentive to recommendations regarding cleaning of high-touch surfaces, including counters, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, and bedside tables. We also advise they take all necessary measures to ensure that all employees, visitors, and persons served who are experiencing any symptoms of illness stay home and avoid contact with others. We also advise they enhance screening of visitors, staff, and residents for symptoms of acute respiratory illness such as fever, cough, or difficulty breathing. For those of you in our community who are not at higher risk, we ask that you continue to practice the following measures. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze with a tissue and throw the tissue in the trash and clean your hands. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. We're also asking that the public follow the CDC's recommendations for using a face mask. The CDC does not recommend that people who are well wear a face mask to protect themselves from respiratory diseases, including coronavirus. Face masks should be used by people who show symptoms to help prevent the spread of disease to others. The use of face masks is also crucial for healthcare workers and people who are taking care of someone in close settings, such as at home or in a healthcare facility. As a result of our public health declaration, our County Emergency Operations Center will also be opened. I'd be happy to answer questions at this point.
What does that mean, that the Emergency Operations Center is open?
Perhaps Jeff Houston can comment a little bit on that. He's our emergency preparedness coordinator.
So that just That just means the EOC will be staffed during the day now, and will be open to any questions, phone calls. We'll have different things up on the monitors down there as well.
What's the best way to get in touch with
With EOC or with who?
with what you just said? What should we be telling people to go to? Where should they be going? I'm sorry, you got misunderstood.
She asked when you open up EOC, the Emergency Operations Center, what that means.
Yeah.
So that's what I was.
Well, I think if you're taking phone calls,
So for any phone calls, okay, regarding this, you should still be contacting Indiana State Department of Health. That's the phone calls that were given out at the last conference. We have those handy, the initial phone calls for a phone number. We can, if you see us right after, we can get those to you.
How about with the case out of West Lafayette? Do you think that they handled it correctly? Have you heard any more cases like that? And what can people expect along those lines?
Sure. So first, the situation you're referring to in West Lafayette, the test results in that situation were negative for coronavirus. So that is not a case of coronavirus. As I mentioned before, there are no other confirmed cases of coronavirus in Indiana, and there are none in Tippecanoe County. I think that that situation was handled appropriately, and that the individual was cared for in the appropriate manner.
You said that Indiana was preparing for coronavirus if ever to make its way here. When did those preparations start, and what did that look like, thinking that this virus would make its way here to the state?
Sure. So at the Tippecanoe County Health Department, we began tracking the coronavirus in late December when it first appeared in China. And then we continued tracking the virus and monitoring the situation closely throughout January and February.
What does that look like? Are you just looking at the news and looking at other, writers and stuff to see if they're on the cases, or what are you doing, I guess, specifically to see how this virus is? I mean, for example, in West Lafayette, they were tested. How did you even know that it was making its way here?
Okay. So we rely mainly on information from the Centers for Disease Control and also the World Health Organization. And they have provided numerous documents of guidance for local health departments, state health departments, and we've been really heeding their advice and following their guidance for preparation, and also following their advice about what the predicted trends are with this illness.
Just a quick follow-up. So are you in direct contact with them daily?
We're not in direct contact with the CDC or the World Health Organization, but we receive updates from the State Department of Health and also from the CDC.
Okay, thank you.
Would you expect that the calm, you're talking about being calm, do you expect it to land in Tippecanoe County, and how long do you think that'll be before we have a case, and what should the reaction be at that point?
Well, I think it's hard to predict the future, to say with any kind of certainty, but I think the fact that there is a confirmed case now in the state of Indiana certainly leads us to believe that it is possible that other cases can appear in Indiana, including in Tippecanoe County.
How many Purdue professors are being quarantined, if any? How many Purdue professors are being quarantined, if any?
I don't have information about exactly who has been quarantined. Yeah, are you referring to quarantine or isolation?
Self-quarantine or quarantine, yeah.
Okay, so self-quarantine would be for people who perhaps have been exposed, possibly exposed to coronavirus, but are not ill. and they are instructed to self-quarantine for 14 days. There are individuals in the county who have had to and are currently self-quarantined. I don't have any information about the specific occupations of those individuals.
Do you know about how many there would be? Do you know how many that would be?
Do we have the number?
Not quarantine, so
Yeah.
we're not up at 5 yet,
Okay.
currently.
But how about self-isolation?
Isolation,
So-
pretty much.
So isolation refers to individuals who are sick, needing to isolate, keep themselves at home, and that number is also quite low. Again, there are no confirmed cases of coronavirus, so nobody is isolating because of coronavirus in Tippecanoe County.
In the case of the West Lafayette family, was that self-isolation or was that quarantine? Or, I mean, what would that qualify as?
In that situation, the person who was tested had symptoms, so they were isolated until the test results came back.
We've been hearing it a lot, and even from, you hear Dr. Adler when you talk about the coronavirus, a lot of the symptoms could just be the flu.
Correct.
And I've seen reports of when it's tough for, say one of us has a fever here, people get a little scared that it could be coronavirus. Are there any other telltale signs that you need to go get checked out? This is more than just the flu, or is it really that hard to distinct? You need those actual tests to see, hey, you just have the flu, or this is coronavirus.
Yes. Yes, you make an excellent point. It is influenza season, and influenza is currently far more common and prevalent in the United States than coronavirus. And the symptoms of influenza and many other respiratory illnesses are very similar to coronavirus: fever, cough, shortness of breath. The indicators for being tested for coronavirus include not just those symptoms, fever, cough, shortness of breath, but also you need to have elevated risk for exposure to coronavirus, and that is defined as either close contact with a known laboratory-confirmed coronavirus case within 14 days of the onset of your symptoms, or travel to a high-risk area where coronavirus is prevalent within 14 days of symptom onset. So if you've had neither of those exposure risks, then there would not be a need to be tested for coronavirus. Your symptoms would likely be due to another more common respiratory illness that we see every year at this time of year in Indiana.
You mentioned the 14 days within, someone who could have been infected with coronavirus. Couldn't that mean today for anyone out in Tippecanoe County, just because it takes so long to see if you actually have the coronavirus once you go through these tests?
I'm sorry, could you repeat the question?
Would be, so you said you need to be one of the things here to test for coronavirus is you need to be someone that has an elevated risk.
Mm-hmm.
When would you be able to know if Tippecanoe County has an elevated risk? Like Dave mentioned, someone was tested at West Lafayette.
Mm-hmm.
Does that put the county, now you said someone in Marion County has one. When would the county be put at some sort of risk so we can let people know, like, take this a little more serious now that there's a risk here in our county?
Oh, I see. Okay.
Yeah.
So first, the case in Marion County would not place anybody in our county at risk because that individual in Marion County has been in quarantine since arriving back in Indiana. Okay, so that person has not been out in the community potentially exposing anybody else to the illness. Here in our community, for example, with the person we were talking about who's been tested, that person was also isolated until the test results were known. So that person would not have spread the illness to anybody outside of their home.
Are you encouraging other people who would maybe have family members who have the flu to also stay home from school, those kinds of things? I mean, are we at that point of caution?
We're not at that point yet. I think the main message today, today is that We need to remain calm, that life is going to go on as usual, but we all need to also be cautious and be thinking about these things. But at this point, no, there'd be no reason for people to stay home for the reasons that you listed.
If a student were to independently travel to one of the high-risk countries, which they are discouraged from doing but can do, how will the health department make sure they self-quarantine when they get back?
So part of that relies on the good faith of people to pay attention to the recommendations, and if they have traveled to those areas to place themselves under self-quarantine, and we would hope that they would contact either their health care provider or the health department so that we could assist in that procedure.
So it's relying on self-reporting mainly?
Correct, yeah. We don't receive reports from the airports or whatnot of people returning from various areas of the world.
Would you hope that with spring break, I mean, there might be places that pop up on the level 2 and 3 or on cruise ships or anything like that? I mean, would you then have that same advice if you come back, self-isolate or report yourself, or what are the chances people will actually do that in high numbers, do you think?
Mm-hmm. I think it's hard to predict how many people would do that. Again, we'd hope that people who travel to areas where there is a prevalence of coronavirus would do the right thing and take care of themselves to help protect their families and their neighbors and their coworkers.
It seems to me that, looking at the starting Wuhan, China, I think a rough estimate was about 6 months ago, and it seems that they are now kind of getting over the virus. They've kind of found at least a containment for themselves, not necessarily a cure for it. For here in Indiana, and for us here in Tippecanoe County, when you see an ended site, you see, H1N1, it's just a cycle of, when something like this happens, then, just like that, we're over it. With coronavirus, how long are these concerns going to last for community members here?
Yeah, I don't think anybody has an answer for that right now. That's just not known. It's still early in the coronavirus outbreak, so I don't think that information is really known.
Thank you.
Does Indiana declaring a public health emergency open the door to more test kits in Indiana?
I hope so, but I don't know the answer to that.
What about the federal dollars that hit sites? Indiana might get more of now.
That would be the hope, but again, I don't know that. Other questions?
But just to wrap it up,
Yes.
while we're ending, just for the community, I mean, I know we're live streaming it too, and, all of us doing our reporting, the takeaway here, because you were here yesterday, I don't know when the next time you're gonna be up here.
Sure.
What's your urgent message here for community members about coronavirus?
Sure. Well, I think the main takeaway is that at this point, we all need to remain calm. The fact that we have one case in Indiana raises the possibility that we could be getting more cases in Indiana, including here in Tippecanoe County. However, right now, we do not have any other confirmed cases, including in Tippecanoe County. So I think we just all need to be more aware and take the usual precautions that we would take every cold and flu season to help keep ourselves healthy.
Thank you.
Thank you. Thank you, everybody. At this point, China, South Korea, Italy, Iran, and Japan?
No, Japan's still level 2.
Japan's level 2. Okay, so people arriving from those countries, level 3 countries, we are informed of their arrival. So, yeah.
Who's informing you that, who
I-
informed you of that?
I believe it's Customs and Border Patrol, I think is who it is, yeah.
It comes through ISDH, just like it did with Ebola, and we contact them and make sure, sometimes we contact them, they're not actually in our county, but we contact everyone, and if they are in our county, they're being monitored twice a day for 14 days.
And so you start monitoring them as soon as you know that that's the case, okay?
For level 3.
Apologies, question.
Yeah.
So if there's a case, say, with like a Purdue student or someone associated with Purdue who like lives on campus, right? Is that something that, are you guys talking with Purdue? Are they letting you know that sort of thing?
Yes, yeah. We have very open lines of communication with Purdue, as we do with all of our other community partners, hospitals, public safety. Yeah.
Okay, so have they shared with you any plans in case they need to like, say, quarantine students who like live in dorms, you know, which are like super tight bubbles? Like how that might hold, or you guys are involved together with that happen?
They do have plans in place, and they have shared those plans with us. I would suggest asking Purdue about those plans. Yeah.
One more time for me, what did you guys speak about level 3?
Oh,
countries?
yes. So travelers who are arriving from level 3 countries, which are China, South Korea, Italy, and Iran, we are notified at the health department about those travelers so that we can assist in the quarantine process and monitoring.
Thank you.
You're welcome.
And that would not include any domestic
No,
cases,
it
right?
does
I know
not.
we're not at any levels right now.
Right. Right.
Would you personally sign off on, I mean, Purdue saying don't travel anywhere in internationally? And they've pulled back their travel plans for spring break, but I mean, is that something that the health department thinks is a good idea or an overstep or too much caution?
Well, I think it's a good idea to avoid travel to high-risk countries. So certainly the countries that I mentioned, and if there are other countries that have, or areas of countries that have a high incidence of coronavirus, the advice would be to avoid unnecessary travel to those areas.
Okay, thank you.
Could you just clarify how many cases the state health department is monitoring? Because I've read 35 and 60 yesterday, or on Wednesday.
How many? Well, there's only one case of coronavirus in Indiana, so there are individuals, so they call them persons under investigation. The last number that I heard statewide was 60. Yeah. And that was either Wednesday or Thursday that number. So it may have changed in the interim. Yeah. Okay. Yeah. There's been no update on that. So. Yeah. Sorry about the item that I misspoke on.
If there's any kind of update this weekend, I mean, are you putting things out? I mean, if something were to change.
If something changes, we will notify you.
Okay.
The phone numbers that you asked for are on the screen.
The state number, that's what everybody's calling.
Okay, just through IDOS.
ISDH,
All right.
yeah.
SDH.
Yeah.
No, they show 2 numbers. Okay, so you want to use the top one. Second one's after hours.